Hey everybody, Jason Moran here with Cardium. Was on the Facebook forums the other day and we came across another question, and that was whether it was safe for patients with heart failure to fly. So most commercial airlines, they fly somewhere in the neighborhood of 7,000 to 12,000 meters above sea level. Now that's just how high the actual plane is above the ground. Their cabin pressure, however, though, is typically around 1,500 to 2,400 meters above sea level. Now, if you're somebody who lives at sea level, this is already quite a decrease in pressure, even though you're in a cabin. Now, if you're somebody who lives well above sea level, this is more of a comfortable range for you. In a patient who has a healthy heart, they're going to typically experience a 3 to 4% drop in oxygen saturation. That oxygen saturation, that's that little device we put a clamp on your finger and it tells you if you have 96, 97, 98% oxygen saturation. So this could be a 3 to 4% decrease in that on a healthy person. Now, somebody who's experiencing heart failure, especially in the higher classes, class 3, class 4 heart failure, you can experience a significant decrease in oxygen saturation. And this actually gets worse throughout flight time. So the longer your flight is, the worse that oxygen saturation can become, putting more stress on your heart and in your respiratory drive as well. Now, in addition to the decreased oxygen saturation, 40% of people with heart failure are known to also suffer from stress and anxiety. This is a considerably high amount and is actually 60% larger than their healthier peers. So people who don't have heart failure or don't have COPD, they're 60% less likely to deal with stress and anxiety. Now, being on a flight can be very stress inducing. You know, that takeoff, that landing, these things, they end up causing what's called a sympathetic response, which basically means an increase in your heart rate, increase in blood pressure, increase in respiratory pattern. Not to mention there's changes in the cabin pressure going on during this. All of these things can lead to significant exacerbations in the heart failure and may even lead to heart attacks or myocardial infarction. All of this is very concerning for somebody dealing with heart failure and trying to fly. Now, if air travel is necessary, there's certainly some things that you can do to help with this. Number one would be possibly considering having some portable oxygen available to you that you can use throughout your flight. Even though the cabin pressure will remain the same, your supply of oxygen then will be much greater, and that'll assist you with preventing that decrease in the oxygen saturation. A couple other things that you may want to consider before even getting on the plane, and that's to first stop, talk with your doctor, and make sure that air travel is even safe for you to even be considering. All right. I know the FFA, they prefer that you be able to walk 100 feet and climb 12 steps before even considering air travel at all. So if your heart failure is to such a degree that you're not able to do those things, maybe this isn't the best idea for you. Another one for you to consider is maybe having your doctor write a brief letter of your medical conditions, something that's an explanatory. So should something happen, or maybe you get to your actual destination and then start experiencing more symptoms and have to go to the hospital, we have something that's actually got your physician's name, address, phone number, and description of your medical conditions. It's a great explainer. While we're on the lists of things, having an updated and accurate medication list that not only lists the generic name of your medication, but also the correct dosage for each medication. Now, patients with heart failure, you folks have a great deal of medications that you're bringing with you. Oftentimes, that's going to be in your checked baggage. You may want to consider having extra medication in your carry-on baggage as well, just in case something happens during the flight and they lose your baggage. All right. One other thing that's you want to be thinking about too while you're talking with your physician is maybe have them do a baseline electrocardiogram. Let's get an understanding of what your heart was doing before you went on your flight versus what it looks like once you get to your destination should you start experiencing some symptoms. Okay? And one last part on here is if you have a pacemaker or a defibrillator, oftentimes those come with a little wallet card that identifies what it is, what it's used for, what the company is. Make sure you have that wallet card with you as well. That's going to give a great deal of information, again, once you get to your destination, should anything occur. Okay? I hope you found this helpful. If you need anything, you can always reach out to me. I'm happy to answer your questions. And in the meantime, y'all take care of each other.